messages. The health service has let me down, and thousands like me. I don't think for 1 minute I'm unique. I know I'm not.
The health service is the number one priority. Now you can see that from the scale of the budget. I mean, the health budget.
It's a frustration patients across the country will share. Elizabeth has been living with chronic pain for 8 years.
I was getting desperate. How many years and how many nights can you stay awake for all the time? It grinds you down. You start off and you're all cheery and you're lovely, and it grinds you down. It nibbles away at you day after day, night after night. Unless you're a wealthy person, you can't see a way out of it. And should it run to that? You know? I thought the health service was there to take care of your health.
After several treatments didn't help, Elizabeth was finally referred for a second hip operation. That was 3 years ago. She's only just been through the procedure.
Frustrating. It was off the scale. That's how frustrating it was. Because it's you're not only talking about the patient who is running with the pain, but you're talking about all the family. I didn't get to see my daughter through her pregnancy because she lives 500 miles away. Desperately wanted to see her, but I was waiting for appointments all the time.
The pandemic has seen waiting lists for operations grow exponentially, but today a step is being taken to increase capacity. Carrick Glen Private Hospital has been bought by the Health Service for £1.8 million. NHS, Ayrshire and Arran take over this site next month, and work on designing the upgrade has already begun. This hospital will be one of 10 national treatment centres, and when the network is complete, it will add 40,000 procedures each year.
I think at the moment it's quite a challenge where, for example, physios and nursing staff are pulled in multiple directions and covering lots of different cases. Even when we get back to the elective operating, the nature of the patients that we're looking after, the patients have suffered a lot longer and more complex, they're a lot more frail, they've lost their confidence, and also it means the surgery itself is more complicated.
The National Treatment Centre programme is set to be complete by 2025, but that's a long time to wait for more capacity.
We'll make it move as fast as we possibly can, but we also have to accept that we can't cut corners when it comes to, of course, making sure that these spaces are clinically appropriate, they're meeting the needs of the local community. But what we're not doing is just waiting for the NTCs to come on board. Of course, we're opening 3 in the course of the next 12 months, which will be excellent. And remember, they're national resources, but we're not waiting around for them. What we're trying to do is ensure that our recovery can begin now.
More centres for the network in Highland, Forth Valley and Fife should be ready in the next 12 months. Sasha Spratt, STV News, Ayr.